Yes, guys. I welcome you guys once again today as we will be discussing what affects our life, as we'll be discussing our health, and as we'll be discussing things that affect our health and things that can improve our health. So today, with Nurse Cynthia and probably another person who will be joining us possibly later in the program. Um, we are mostly welcome, and if you have any question, you can always drop it on the comment section, and we'll pick it from there. So here with me is Nurse Cynthia, like last week. So we are happy to welcome you once again, and we hope you enjoy this program. God bless you. Yes. My dear sister, Nurse Cynthia, welcome once again on our show.
Yeah,
Once again, we want you to introduce yourself and let's know you.
yeah. Thank you for having me in the show. My name is Cynthia.
Okay, welcome.
Thank you.
So today we'll be discussing about diabetes. And the diabetes is a very important topic and a very important lesson we need to learn about how it works and how it affects us. Diabetes is mostly affecting both young, old, and youth. So today, Cynthia is going to dwell so much on this topic so that we will learn from what a professional have to say about diabetes and what you might have been hearing all this while. So, now, Cynthia, without wasting much of our time, let us hit it. What is diabetes?
Okay, diabetes is simply a disease causes that is caused by elevated blood glucose, that's increased blood sugar. And a lot of people have this misconception that if you take sugar now, they'll tell you, you have diabetes, so because you're taking sugar or you're taking excess sugar. No, it doesn't happen that way. So it's either your pancreas don't have enough don't produce enough insulin, or your body does not recognize your insulin. So without that, your body is okay no matter the level of sugar you take. But in the future, if you take too many sugar, it affects in the sense that it gets you obese, and then it will affect your beta cells, which produces this insulin. So in summary, diabetes is a disease of increased blood sugar or blood glucose.
Thank you very much. The second question is how can I be tested for diabetes?
Okay, they have series of tests to do, but the very common ones are the fasting blood sugar and random blood sugar. Now, if you go to the hospital, and most people have this glucometer in their houses, the glucometer is just something like this. It's small like this, but it's not necessarily this, but it's small. It's like a small phone. So you just get your diabetic and glucose, what they call it, the strip. Using the strip, you try to puncture your hand, and then placing the blood on the strip, then insert it in the machine. It will just tell you your blood glucose. So when you're checking it at any time of the day, you're going to get your random blood sugar. But when you're checking it like first thing in the morning, you get your fasting blood
So it is required to be tested or to be done early in the morning after food. Is that what you mean?
Yeah, early in the morning before you eat, like let's say around 7. Yeah, around 7 or 8, you can check your fasting blood sugar. Yeah.
Okay. The next question is what health problem does it cause? What health problem does diabetes cause?
What health problem? Okay, like you mean the signs or
The health, what is no, I mean,
okay, what exactly does it feel like to have diabetes
yeah,
or
what
the
health
sign?
problem? Like, what will be the symptoms and probably the result of when you say you have a diabetes? What is the health problem? Does it affect bone? Does it break bone? Does it swell up? What's the health problem?
Okay. So it's more like I'll just explain to us the pathophysiology of this disease. Now, excess intake of glucose could cause insulin resistant diabetes. Now, first of all, I would like us to know that diabetes is of two types. That's like commonly of two types, but there are other types which I'll just hint us on. So these two types is type 1 diabetes and type 2 diabetes. Type 1 diabetes is a kind of diabetes you get from birth, like or you're being born with this diabetes. It's inherited.
Hmm.
But type 2 diabetes is acquired, like as life goes on, you based on your lifestyle and all that, you acquire this diabetes. And then they have gestational diabetes, which is acquired during pregnancy and so on. So, but I'll be letting us throwing more light on this type 1 and type 2 diabetes. Now, type 1 diabetes, they are insulin dependent diabetes. So these people live on insulin all their life because there's probably a destruction in the beta cells of their pancreas. So when the pancreas is not producing insulin at all, yeah, so your body does not know or have enough insulin. And this insulin helps our body to this insulin, as I was saying, it helps our body to what's the word I will use to get more energy. So without insulin, our body cannot get this energy. So the insulin is like a transport system that takes energy to our body. Now these beta cells are being destroyed in type 1 diabetes. When it's being destroyed, these people don't have a means of getting insulin, so they live on insulin all their life. But the type 2 diabetes, which is acquired through the lifestyle and all that, that's people with obesity or stuff like that. Now, getting this type of diabetes, it can be managed to the extent of you feeling like you don't even have diabetes again because with proper management, you take your drugs properly, you refrain from all this junk food, fatty food, and just maintain a very healthy diet, you see that the signs and symptoms will lessen so much that you won't even feel like you have diabetes again. So that's the two types of diabetes and how they affect us. Now, if someone has diabetes, the very important sign that shows is the three P's. We call it polyuria, polydipsia, and polyphagia. Polyuria is excess urination. You see, they will be urinating frequently.
Hmm.
Polydipsia is okay. I said polyuria, polydipsia, and polyphagia. Polyphagia is excess hunger. You see, they will always want to eat. They always want to. They're always hungry, and then they're always thirsty. That's polydipsia. They're always thirsty. So this set of people, They drink a lot of water, they pee a lot, and they eat a lot. And now all this food that they are eating goes into their system, produces sugar or glucose. Now, instead of this glucose to go into the body cells, it remains in the blood. It does not go into the blood cells. It is not taken. So there's excess glucose in the blood, which which is the main so yeah. So that's basically what happens in diabetes. And other things
Your
could
line is
kill,
breaking. Are you having call or something? Your line is breaking. Are you having
it's
some
ads.
distraction? Ads.
No, I think, yeah, this ads of a thing. I don't know.
Okay. All right.
Yeah. So
Thank you very much for that well explained. You still want to say something on that?
yeah, I was going to say more of the signs that you can see when one
Yeah, right.
has diabetes. So they can also see foams in their urine. Like when they urinate, their urine is always foamy, and then it's very sugary. Like their urine contains a lot of sugar. Now you won't get to test your urine, like putting it in your mouth, test it. You can know your urine is sugary when you pee on a space and then you see ants gather around. You know ants. There are ants that loves sugar so much. So because you pee on the spot, there'll be ants all around the spot. So you know, oh, my urine is quite sugary, and then you know that, yeah, these are symptoms or signs to show that you have diabetes. And some other signs that has shown that your diabetes is actually going very high is slow wound healing. People with diabetes, whenever they have a wound or injury, it doesn't heal fast. It always stays for a long time before it heals. And if you're not careful or you don't take care of your wound properly, it will keep eating up your leg or your hand or that part till they amputate the part out of your body. So you need to take care of your body very well if you notice these signs that we're talking about. And there are a lot. But let's just hold this one for now.
All right. Thank you very much for that well explained uh, answer.
Yeah,
So
I
the
know.
next question is, what type of diabetes normally someone can easily get? What type of are there, like you explained, types of diabetes? What type of diabetes that ordinarily somebody can easily get?
Okay, the type of diabetes that can be easily acquired is the type 2 that I said is acquired diabetes. Now, a lot of things, diet modification these days could expose you to this diabetes, because now a lot of us go for packed food. If we come back from work, we'll be so tired, we just want to eat one whole pizza and sleep, or eat one big burger, and all those things would keep accumulating in our body as fat, as glucose, and all that. So having too much of this would expose you to obesity, and at the end of the day, you check all this draws back, sorry, to the BMI. Your BMI will exceed, and then you become obese. Now, becoming obese, your body, due to the excess glucose in your body, the insulin your body produce would be your body will be resistant to that insulin, because there is excess sugar already in your system. So instead of your body to see the insulin and then accept it, so the insulin can help our body cells attract glucose, it will now um it won't attract this insulin. Like, there's no bonding with this insulin because it doesn't want it. it's resistant to it. So you have to get an external insulin to be injected in you to help your body process the glucose. So the diabetes that is easily contacted or easily acquired is the type 2 diabetes.
Okay, thank you very much. I think the next question we are supposed to ask, I think you have uh, done some justice to it, but we'll continue to ask because it's
Okay.
already in my line of questions I need to ask. So,
Okay.
without wasting much of our time, as we appreciate you in explaining well and to our own local understanding, we that are not health professionals, we also want
Yeah.
to ask more questions. How can diabetes be treated?
Okay. Diabetes can actually be treated, but there are some type of diabetes that cannot be cured. It can only be managed for the rest of the person's life.
Hmm.
And with proper management of this condition, it will get to a stage where you feel like you don't even have it, because although it could still affect you a little, but it's not very pronounced. You can live a normal life as
Hmm.
long as you're taking proper management. So for the type 1 diabetes, it cannot be treated because now the beta cells are destroyed. So there's no way you can get insulin from your body again. So you just have to be taking external insulin. It cannot be treated. Now the type 2 diabetes, which is acquired, we brought it upon ourselves by ourselves. So you can actually modify your diet and then help yourself to get um proper management, and then to some extent you can help yourself to be treated well, but to be cured it can actually take a very long time, but it's actually can be cured to some extent, but I don't think it can be cured totally like that. But since it's acquired and then your body is still producing insulin, it could. So you just have to cut out with all the junks and all that, take your medications properly, and do well with your diet, and it helps.
All right, thank
So
you very much.
your question, was I able to answer your question?
Yeah. It's
Okay.
well cleared. Yeah, it is well answered.
Okay.
Um, the next question is, what can I do to help prevent diabetes? What can one do to prevent diabetes?
Okay, yeah, there are simple things to do to prevent this diabetes. Now, diabetes is not it's not something that just come up in, like, you just sleep and wake up and have diabetes. It comes gradually like that. So if you can try to maintain your diet, I think you can make a good you can take much more vegetables, much more fruit, and less with the intake of junks and all that. It will actually help. Do more of exercise, go for workouts, stuff like that. It actually helps.
To prevent.
So, yes, to prevent. So do workout, eat healthy, avoid eating too many junks. A lot of people live on junks these days. They'll just come back from mall, go to the mall, get canned food, and just eat. So know what you eat. Eat healthy. So yeah, that's
All right.
a way to prevent it.
All right. Thank you very much. Is the next question is it actually from sugar? The diabetes, is it from sugar or sugary food, or is it, there are like carbohydrates is contained with sugar. What kind of sugar are we talking about? And is it possibly coming from sugar, food, sugary or normal sugar, or what? Just tell us, is it what type of sugar and what is it from sugar actually?
When I started, I said there is a misconception that people have, that they said if you take sugar, you have diabetes. It doesn't really, really like directly work that way. If you take sugar, you would increase the amount of glucose in your body. Yes, and then if there is excess glucose, it could actually lead to obesity someday. That if you take it for a very long time, could lead to obesity. And this obesity now is what will cause insulin resistance from your body. So the sugar itself is not like the what will just cause it. It's like something that can trigger, or yeah, something that can trigger. Excess intake of sugar can trigger it, but it's not the main cause. The main cause of diabetes is if there's a problem with the beta cells of your pancreas. So now, if your pancreas is not producing enough insulin, there will be a problem. And now this, or if your beta cells are being destroyed, there's no way you can get insulin. So that's the problem. You need insulin, or your body is not accepting the insulin that your body is producing. So that's actually the problem. But it's not that taking sugar is the main problem of diabetes. No, that's not the problem.
Okay. The
So
the you want to say something?
no, no.
All right. This diabetes, is it transferable? Is it inherited, or anybody can have it?
Okay, yeah, the diabetes actually can be inherited, especially the type 1 diabetes. It's actually inherited, or diabetes is a disease that can be inherited, and also it can be acquired, like I said earlier. Your lifestyle can predispose you to diabetes. And if your lifestyle doesn't predispose you, it's either no, it's either this person has it from birth, like they gave birth to this person with diabetes, or they acquire it through their lifestyle. So it's actually inherited. It can be inherited.
Wow. So it can be heritable.
Yes, it can be
Yeah. Now I have had a friend who said all her mother all her life she avoided sugar because of diabetes. At the end, she died of diabetes. What can you say about that? She avoided sugar to avoid diabetes.
Avoiding sugar is not like the main thing to do in patients who are trying to avoid diabetes. Now, if you're born into this family and then okay, your mom has diabetes, your sister, all those people has, you are in a place to also have this diabetes, because if you just let yourself loose and then don't feed well and then don't take proper diet, you could predispose yourself to diabetes. So the best thing to do is to take precautionary measures like taking enough vegetables, taking enough fruits, engaging in exercise, watching your BMI, and then that's just all you need to do. You don't need to like say you're avoiding sugar. We need sugar in our body because sugar is a source of energy. It produces glucose, and this glucose is used as energy for our body. So we need sugar actually. Eventually we still need sugar because there is sugar in our yam, there's sugar in our rice, there's sugar in a lot of things we eat. So you cannot say you would avoid sugar totally. No. So you just have to eat right, check your body. Once in a while, you can even go and take the test, your blood sugar test. You check it to know how, if your body, if there is too much glucose in your blood and all that. So yeah,
Okay.
that's it.
During tests for diabetes, is it gauged? How do we know that we have whether it's high or low, and what is the acceptable level for diabetes? If it is scalable, like what I said, what is the level you can get? Like we check our blood and they say today we have 48 out of 120, this. Is it in that manner? And can you do well to explain more about that?
Okay, yeah. In checking your blood sugar, there are ranges, and it's not like they will check the blood sugar today and then it's maybe high and then they'll tell you you have diabetes. No, they have to check it for like 3 to 4 times to have that very high level of blood sugar before they'll know, okay, you we think your blood sugar is very high, and then this can predispose you to diabetes. But checking the blood sugar once does not really mean you can get diabetes. No, it doesn't. It doesn't really show like you can get. Okay. I checked mine not quite long. The the normal range for random blood sugar, if you're checking it, if you're having um 9 millimoles per day, it's normal. You're having 9, you're having 10. Yeah, it's normal for some people. Like 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 for me, I know I'm utilizing my energy level a lot because I go for workout. You don't expect someone who sits in the office from morning to night doing nothing to have the same blood sugar as someone who always do activity, like who goes for running and all that. The amount of sugar the person who is always in the office sitting down needs, it's not supposed to be much because this person is not utilizing a lot. But this person who is running, who is jogging every time here and there, needs more energy. And then this person would probably take more sugar to compare to someone who's sitting. So now if you're checking the blood sugar, the one who's doing more activity, now, after this activity, you notice, okay, the blood sugar has dropped because they've used up the energy. And then you see someone that's sitting down and then you check their blood sugar and you see that, okay, it's high. That doesn't mean, okay, you have diabetes. No, it's not. They have to check it like 3 to 4 times to know that, to have a high level before you would conclude that this person has diabetes like that.
Okay, what are the symptoms of diabetes?
Okay, the symptoms we talked about it earlier. I mentioned the 3 P's that we can that they can see always, which is the polydipsia, polyphagia, and polyuria. Polyuria, excess urination; polydipsia, excess uh, thirst; and polyphagia, excess hunger. So this person eats a lot because now, why they are eating a lot? Because their body cells is telling them there is no energy. You need to eat food to have energy. And then you are eating the food, glucose is being released to the blood. The blood is not giving the body cells this energy. So your body your body will still keep saying, give me energy. So you keep eating and eating and eating, but the sugar will be accumulating in your blood, but it's not entering the body cells. So your body will be weak. And another sign is weakness. You'll be weak and tired and all that. You would probably get a moment where you have blurred vision, because when someone is very hungry, the cells in your body are not getting energy. You won't see clear, you'll be seeing blur. So yes, you have blur vision. And then you feel like you don't have energy, but you're eating a lot. That's to show that your body the glucose is being stored in your blood. Now if they check your blood sugar at that time, it is very high, because all this glucose is in your blood, but it's not entering your body cells. Now your body cells need this glucose to to be strong. It's just like they need food to be strong. So you're eating this food instead of this food to be entering your body cells, with the help of insulin. Now your body is not accepting the insulin you're producing, or your body is not even producing any insulin. So there is no glucose sent to the body cell. They are just there in the blood. and they are not entering your body cells. So you have blood vision. Some people might even have episodes of vomiting and having nausea. Nausea is a feeling where you feel like vomiting, but you're not vomiting. And then you feel like vomiting, but you're not vomiting, like that. Then eventually you start vomiting. Most people with advanced um, diabetes will have injury. Most times the injury occurs in their extremities, which is the leg or maybe the hand or something. And it will be a very small wound, but you see it will keep they call it necrosis. It's keep killing the cells around it, keep dying. That's because this wound that has been this wound that has been on your hand is not healing fast. There will be slow wound healing. Now, instead of it to heal, the blood there is very, like I said, all the glucose are in the blood. They are not in the body tissues. So, due to the excess glucose in the blood, the instead of the wound to heal, the microorganism will be eating from it, so it won't allow it heal faster because the glucose is too much there, so it will keep um getting rotting like that. They call it necrosis, so it will keep dying, the cells will keep dying. And that's why if it affects the whole hand, they will tell you to cut off the hand, that's amputate the hand. And if you don't do that, it's just like you're having a tube of yam, and then this side is spelt and here is not spelt. When you want to cook, you won't cook all the yam because it is yam. No, you don't have to do that. You cut out the place that is spoiled and then cook the good part. That's same thing with our hand. If you have this kind of necrosis, you have to cut out the part that is not good to avoid spreading of this necrosed parts. So you just have to cut it out, and that can be very, very painful, you know. Yeah. And
Wow.
then there will be the numbness in the hands and feet. So you could feel like your hands are not, you're not feeling them. There will be numb feeling in your hands like that. So yeah, those are the symptoms you can feel.
Right. Thank you very much. The questions are well answered, and I believe whoever that will be watching this video, whether now or later, will be enjoying it as I'm enjoying it because I'm learning a lot because I'm not a health practitioner, but I'm getting a lot of information that I never knew. But another question is, how often do we check our diabetes, or how often should we be checked so that we will know if we have or not? Like the last time you said you are talking about it have to be checked several times to before we confirm that somebody have diabetes. So how often is it? A day to four times a day, like 1 week or 1 month before you can confirm?
Oh, okay. So if you are the type that is having a normal blood sugar, you check your blood sugar today and then it's normal. There's no need of checking every day like that. So it's better you check maybe, like me, I check once in a month and it's normal. So I just, it's not even something I do like often like that. But I think if I would advise, I would say you should check twice in a month. It's good. And if you check at one point and you notice, okay, my blood sugar is high today, the next day you check again. And if it's still high the next day, you check the day after that. And if it's still high, then you report to the hospital for proper diagnosis.
Okay, good. Thank you very much. On that question, I have a follow-up question based on what I just asked. What is the is it possible? What is the effect, digestive effect, if somebody have diabetes? Like, I mean, if you somebody have diabetes, is it possible for that person have a normal digest? Like you eat after eating, you know what I mean by digestion.
Okay.
Does he what effect does diabetes do in this? Is it a what does he digest food fast or low? Because you're saying something about eating more or something. Does it mean that you have a fast digestion, or can you explain more on that?
Okay. I said you eat more, yes, because now after eating, yes, your body try to digest this food very fast so that your body cells will get energy. Now your body is trying to compensate to produce more energy. Now, the more you're eating, the more your body is digesting it and releasing this glucose into your blood. Now, it is the function of the pancreas to release insulin so that the blood can so that the insulin can allow the energy in the blood flow into the body cells. Now the pancreas is not producing enough insulin, or the insulin produced by the pancreas is not being recognized by the body. Now this glucose are in the body. Yes, they are in the blood. But now the body is not accepting it because there is no insulin. Insulin is just like a middleman to tell the buyer and the seller, okay, you want to sell this thing, you want to buy this. It's a person that brings them together. The insulin brings the body cells and the energy together, or the glucose together. So without the insulin, there is nothing to bring them together. So even though they are together, they cannot even recognize each other, or even function properly. So they need the insulin to function. So without the insulin, they cannot function. Now you've eaten, your body is telling you that the body has a way of communicating with itself. So it tells itself, the body cells will tell the body that I need energy. Now allow this person to eat. You will eat, and then your body will digest it. After this digestion, energy will be released, or glucose will be released to be sent to the body, or the body cells. Now the body cells is not getting this energy because there is no insulin. The body cells will still complain again. I need energy. You will be very hungry. Your body will now make you hungry. You will eat. The glucose will still enter into the blood, and then it will not get to the body cells. The body cells will complain again. I am hungry. It will tell your brain will tell you what to do, and then it will tell you you are hungry, you need to eat. So you'll keep eating and eating and eating, but you are still weak because this energy is not getting to your body cells. I don't know if you understand what's really happening. So you keep
Yes.
eating and eating, but it's not entering your body cells. So that's what happened in diabetes. So you keep eating, and then you'll be very hungry. Your body will be telling you that you are very hungry, but you are full because there's a lot of things in your body. There's a lot of energy. There's a lot of glucose, but it's not being transferred into the body cells. So that's the problem with diabetes.
Okay. Thank you very much. Well understood. The next question is it a cause? I mean, is it a specialty on its own? Is it what some physicians will study on its own, or is it done? Who is responsible for treating this? Is it a general doctor or a specific physician? Who is responsible for treating this?
Okay, for treating diabetes, I think all if someone has a serious case of diabetes, all the health workers are to be involved in the treatment, because it's not just one person. Because if this person has already developed a pressure sore, or a wound, or something that has gone far and rotting for a long time, you don't expect only the nurse to take care of this person, or only the pharmacist to take care of this person. So this person will come to the hospital, be seen by the doctor, and then there will be prescribed drugs for this person. The nurse will do her part. That's the doctor's part to to diagnose and prescribe drugs. And then the nurse will do her part by taking care of the patient, helping the patient with the injury, cleaning the
No,
injury,
no,
because
no. No, what I'm asking is, there are specialty doctors like if a doctor of there are doctors there are general doctors who can treat anything, and there are doctors
Oh,
who specialize on some specific part of the body, like fingers, like eye doctor, like you know
okay,
what I
okay.
mean. So, is it who is responsible for treating this?
Is a medical doctor because uh, a medical surgical doctor, yeah, and a medical surgical nurse because they work together. This is a medical condition because it's a metabolic disorder and a medical condition. Hey, so you don't expect only one specific doctor or a group of doctors to do this job. So both the doctor, which is a medical surgical doctor, and then the medical surgical nurse would take care of this patient to bring them to their recovery.
So it's not something of specific. It's not specific for one particular profession of
No,
doctor.
no, no.
It's a
I
general.
understand
It's a general doctor that will do that.
like the way, yes, like the way they have orthopedic doctor, pediatric doctor, stuff like that. No, it's a medical doctor. Medical doctor can take care of
Yeah.
that.
No, what I mean, I know they are all medical doctors, but is there any specialty? Like, you know what I mean? There are doctors that
No,
are orthopedic,
there's
that
no
are the ones of.
specialty for
There's no,
diabetes.
okay, that means general doctor.
Yeah. Okay,
General
you
doctor.
call it that. Okay.
All right. And our show will be coming to an end, but the last question is um, do, how often or does this diabetes lead to death? As in, is it that serious that can lead to death, and how can that occur?
Okay. Diabetes can actually cause the death of someone because now imagine your body cells not getting enough energy for a long period of time. There will be excess glucose in your blood, and then your body is not getting. And then okay, this person is having blood vision. Very soon, the person will start having mental confusion. Sorry, serious confusion because your brain needs energy. Brain has cells; they need energy, but they are not getting energy. So if it stays for a very long time, you it could cause the life of the person. And if the person is having this type 1 diabetes, we know that these people live on diabetes for all their lives. Now you are the type that you need this insulin. You need insulin to survive, and then you're not taking insulin. What do you expect? There will be nothing to help transfer energy to your blood cells. So it will actually cause the death of the patient if it takes longer time because excess blood sugar will begin to affect the individual in every way. If a diabetes stays for a long time, if you notice, most people with diabetes come down with hypertension and then kidney problem. Now you are having excess urination, you are stressing your kidney, you're going to urinate every time you're actually causing stress on your kidneys. Before you know, if it stays for a very long time, it could cause and kidney problem and then kidney failure at some point. So you have to be very careful and take your treatment very serious because I think there's no sickness or illness that is a small sickness like that. Anything you're treating should be treated um well. You're not supposed to treat something halfway and then just assume, okay, it's a small thing, I can handle it. No, you should treat yourself properly. So, because they say health is wealth, you need to be healthy to live a full life and, you know, a life that you want. So yes.
Yeah, thank you very much. Thank you very much, Nurse Cynthia, for doing justice to our numerous questions that we have asked. And we appreciate you so much that we have learned so well detailed questions we have asked, and we have learned a lot from them. We appreciate you so much. Please give your concluding remark, and then we call it a day.
Okay. Thank you for having me in your show today. I'm very grateful. And today we talked about diabetes, yes, and I know we've learned a lot about this diabetes. So we should do well to, if you know you are having all these signs and symptoms, try to go and see your doctor and get a proper diagnosis. And then if you know you've not seen any sign and all that, try to live a healthy life. Avoid too much junk food, avoid too much drinking, avoid too much smoking and all that. They are unhealthy attitudes or unhealthy behaviors. So avoid them, and then try to eat more vegetables, try to eat more fruits, drink enough water, keep yourself hydrated. Health is wealth, remember. So yeah, and don't
Thank you
forget to
very
follow my page, not
Yeah, very
Cynthia.
important. Yeah,
Very important.
very important. Yeah. So, guys, you guys have heard from the horse's mouth. Here with me is Nurse Cynthia, and you guys have heard from her, and she have detailed every detail, every question. She have done well to answer them specifically and well detailed. So we have learned a lot, and we will continue to learn. Next week, don't fail to be here to be part of our program, and invite your friends. If anybody want to be part of this, and the person is a doctor or a nurse, do well to link up with us. Just give me a DM or a chat or a comment that you want to be part of it, and you want to, if you want to correct impression, if you want to say something, or if you want to treat a topic, we'll give you the audience, we'll give you the opportunity to do so. And we so much appreciate whoever that is watching and who will be watching later. Please do well to follow our sister Nurse Cynthia, as she always come here every week to educate us on our health concern, and it's very, very important that we learn so that we take precautions. Thank you very much. Until we'll see you again next week. Please do well to always come and join us next week by 8 p.m. We are started today. We apologize. We started late, and we're going to make some corrections. Thank you very much, always, and always be here. And if you want to make money online, I said it last week and I put it here. It is trolling down on this system, if you can see. And a lot of people are taking action and they are making money. This will not cost you anything. Just with your smartphone, you can make dollars into your bank account every Saturday. You can be paid in dollars just for you to recommend products from the producers, and then refer to buyers. They will buy, and then you get your commission. You are not going to buy, you're not going to produce, you're not going to do anything, just to recommend. And you go home with dollars. You paid with a commission. Thank you, as we continue to do well to find a solution to the issues of our concern, which is hunger, mostly those who are in Nigeria. Please take time, and please make sure that you are not falling victim of diabetes, so that you will not go to hospital and be amputated. And we expect you to be healthy and alive to always watch our show. Thank you very much. Until we see you again next week. Bye for now. Bye.